So it is the month of May 2019, and it is Mental Health Awareness Month for borderline personality disorder. And I wanted to make a video because as someone with BPD, there are a lot of things that I think people misunderstand. So kind of wanted to make a video on it. Not that I make YouTube videos, but there we go, I'm bored and yeah. So I was diagnosed with BPD when I was 17 unofficially, when I was in an adolescent psychiatric unit for 9 months. And then I was diagnosed officially on my record, as far as I'm aware, when I was 20, having had almost 2 years out of therapy where I just sort of spiraled and couldn't engage, and things got really bad. So there are lots of different criteria that you have to check off as such. I think that you have to get 5 out of 9 to be diagnosed, and I think I have all of them, which is kind of funny. I know that they're redoing the new DSM-5 is coming out this year, 2019 or 2020, I'm not sure. And I know that they're redoing a lot of BPD with the diagnosis criteria, because it's very unspecific currently, and a lot of the symptoms are symptoms that neurotypical, sort of normal, healthy-minded people have at different points in their life. You can have it at different points due to puberty, due to, life events happening. It doesn't necessarily mean that you have borderline personality disorder. So I think there's a lot of misdiagnosis because of that. And I think that they're redoing it, especially number 5 on the list is self-harm and suicidal ideation. Self-harm is currently only under borderline personality disorder, so a lot of people being diagnosed with it simply because of dealing with self-harm, and it doesn't necessarily mean that you have it as a disorder. So run through the symptoms as they are currently, and just discuss them a little bit. I think maybe, I'm not sure. Anyway, we'll see how it goes. So number 1 is fear of abandonment. I think this one is the one that people don't understand a lot, because I definitely know that I deal with the fear of being abandoned by pushing people away so that they don't abandon me first, which to any sort of normal, healthy-minded person, that is ridiculous, because you're just creating the scenario and the situation that you're scared of in the first place. I think a lot of people with BPD also experience that. It's the sort of the extreme chronic feeling of panic that overtakes you, and all rationality goes out the window, even if you can rationalize it in your head and say that isn't a healthy thing to do, or that isn't a normal coping mechanism, or I can see that what I'm doing isn't the right decision. You can't often overcome that because the obsession of what you need to do is so strong, regardless of how rational it is. That was a bit of a tangent. Anyway, so that's the first one, fear of abandonment. Number 2 is unstable relationships. This can range from relationships with friends, family, sexual relationships, platonic relationships, just sort of, anyone you meet. Having unstable relationships means, to me personally, I cause a lot of arguments or in relationships because I'm scared. I'm scared they're going to leave me. I'm scared that I'm not good enough. I'm scared that, I don't know, I can't rationalize jealousy a lot of the time when I'm really unwell. And so unstable relationships are, a main part of my life personally, and of people with BPD. It means having friendships is quite hard. I'm very lucky to have the most incredible friends who have stuck by me. Admittedly, I don't have as many friends as I used to when I was at school. That's simply because I was unwell from probably the age of, like, recognisably when I was at school from year 8, so 13, 12, 13, until now. So I'm 23, so 10 years, and a lot of my friends have gone to university and moved on with their lives and got incredible jobs, and I don't see them anymore, or they didn't understand my mental illness, and I don't blame them, or I isolated myself and therefore lost friends, because friendship is a two-way street. You have to make an effort with them for them to make an effort with you, and I'm very lucky that the friends I have still are people who are stubborn little shits, and they stick with me through thick and thin. They're great. So mwah, shout out to the people who love me and stick by me. So I can't thank you enough. Anyway, number 3 is oh no, my ring is stuck in my hair. Got my ring stuck in my hair. I'm not going to do that anymore. I'm going to touch my hair. Anyway, right. I've got hair stuck in it. You can't see that? Oh, for fuck's sake. Anyway, number 3 is an unstable self-image. I think this is a really big grey area when it comes to diagnosis, because I feel like, especially in this day and age, I guess, a lot of people are having like a severe unstable self-image sort of problem, because, you know, if you look at historically, people were, you know, you were a worker, or you were, you know, rich, and you didn't have to work necessarily, or you know, you were in a certain category. And especially, you know, if you were in like the Victorian ages, you had very much the bottom, which was like the workers, you know, like chimney sweeps and like builders and like blah blah blah. And then you had like the middle class, and they sort of, you know, were in that sort of in between stretch. And then you had the upper class who didn't have to work, and people knew their place. People knew what job they were born into, basically to do with what their family were in. We don't have that now. We have a lot more luxury of people from any background can go into any job if they have the money, or if they work hard, or if they, you know, especially in the UK, you don't need a scholarship necessarily. Like in America, it's not to do with money necessarily. You know, you can go to university and get a grant, and you can pay it back potentially in the future. There's a lot more opportunities, which means I think a lot of people have this panic that sits in them, that means that you don't know like who you want to be. You have this pressure to go to university and be this certain job role and pick it when you're 16, and there's a lot of anxiety that comes along with growing up nowadays. I think a lot of people have unstable sense of image and self. It's hard to be self-aware at a young age when you need to make all these big decisions for the rest of your life, and I think there's a lot of pressure put on it. So I don't necessarily think that unstable self-image is a specific category that should be with BPD anymore. I think it's very much a generational thing. Cool. Okay, number 4 is impulsive self-destructive behaviours. Now this is different from self-harm, which is number 5. So this can be things from gambling, spending lots of money, doing, you know, lots of shopping. It can be being a boy racer, you know, like fast cars and taking those risks. It is, you know, sleeping around with a lot of people, and, you know, potentially not being safe from STIs, STDs, not looking after your mental health first, putting your physical health first, you know, being really unhealthy. It's often linked with eating disorders, comes into this category, sort of like comes with it, with the self-destructive behaviours, alcohol, drug abuse, and then also being impulsive comes like the main part of it. So like, you know, impulsively doing these things, you know, not planning to do them. Just if someone goes, oh, you know, do you want to take some coke? And you're like, yes. And then as soon as you've taken it, you're like, what an awful idea. But because you're impulsive, you can't take it back. It's already done. It's quite a negative one. I think, again, generational category wise, this one is a lot more of an issue. I know so many more people who are so much more impulsive. I know so many more people who are, again, very, very self-destructive, but wouldn't call it that. And I think, you know, as people say, and you know, with the symptoms, you need sort of 5 or more of the symptoms out of the 9. So it's not necessarily that everyone has it because they've got one. And I think that's why it's really good from why the new DSM-5 is coming out with the new sort of like layout of how it's categorised and how it is going to be diagnosed in the future.